Hi, welcome to Checking In with Amy. I'm delighted to see you again. My name again is Amy Golgberg. I'm a registered nurse with the Elder Service Plan of the East Boston Neighborhood Health Center. We serve people that are 55 years of age and older who live in our catchment area of East Boston, Chelsea, Revere, Winthrop, and Everett. And the goal of the Elder Service Plan is to keep people living in their homes independently, healthy, in an active manner. Today, my guest is Dr. Ankur Bharija, who is a geriatrician and a palliative care specialist. I want to make note that he told me that there are only a few thousand fellowshipped, trained palliative care specialists in the United States, and we're blessed to have two in the Elder Service Plan. So welcome, Dr. Bharija.
Thank you, Amy. Thanks for the kind introduction. I'm very happy to be here.
Well, thank you. So tell me, Dr. Bharija, a little bit about your background.
Sure. As far as my role in ESP is concerned, you very well know I work as a primary care physician here and assist with the various programs for our elders and older adults in the program, trying to keep them safe, healthy, and independent in the community. When it comes to my background, by virtue of my training, I'm a geriatric and a palliative care specialist, as you mentioned. I specialize in taking care of older adults and frail elders in the community, whether it's assisting them with safe and healthy aging or adding quality of life.
So how did you happen to choose the path that you did?
Well, it's interesting. I was thinking about that. Growing up in India, in close proximity to aging grandparents, and eventually witnessing their passing as a medical student myself, I remember those last few years, months, and weeks as a very human experience. You know, an experience that we all as a family lived with them through the end at home. So there was suffering, of course, for many reasons. Some of it we could alleviate, and some of it we couldn't do much about. But when I came to the United States, I was amazed by a lot of technology in healthcare and helping us save lives and achieve extraordinary measures. But I was disturbed by a different kind of suffering here. The suffering which was imposed by what I felt as over-medicalized aging and dying. These were some inevitabilities here that I felt that as a society and a healthcare system, we were ill-prepared to deal with. But when I stumbled on to palliative care and geriatrics, I saw a sense of empowerment where there was more acceptance for the suffering, acceptance for the inevitability of aging and dying, and that brought in that human experience in taking care of a person as a whole, and that's why I went on this path.
So tell me, we talk about palliative care, so tell me, what exactly is this?
So palliative care is essentially a specialty in medicine which is for seriously ill patients with life-limiting illnesses. The aim is to alleviate suffering and enhance quality of life, not only for the patients but their families as well. It is typically delivered with a team, more often than not in concurrence with curative treatments, and can be given at any age and any stage of the illness.
So who would be an ideal candidate for palliative care, and how can our viewers ask for palliative care?
Sure. So, as I said, palliative care is appropriate at any age, but for the purposes of our conversation, obviously, we'll limit it to the adult and older adult population. Let's consider an example. Someone who's in their 30s, 40s, 50s perhaps, and are diagnosed with a serious illness like a cancer. It could be stage 1 or stage 4. It could be a curative or non-curative. but it is appropriate for them to have palliative care right at the diagnosis of the illness because of the anticipation of suffering that is going to come from the disease and the treatments. We can consider another example of something as common as diabetes, someone with multiple common ailments, diabetes that brings about heart failure, kidney failure, and so forth. What happens is when these common medical problems accumulate over time, you reach a stage where there's too many medicines, too many doctors, and the burden of common ailments becomes critical, and then palliative care is appropriate. We could also consider an example where someone is just very elderly and frail and slowing down, both physically and cognitively. They may not have one serious diagnosis.
Right.
They may not have multiple medications or multiple chronic ailments, but things are just slowing down and the family needs help. Palliative care is appropriate at that stage. So when it comes down to who is appropriate, there's a whole host of scenarios that are possible.
So one of my main questions to you when we first met about this subject is tell me the difference between palliative care and hospice.
Sure. Hospice is essentially palliative care at end of life. It is a Medicare benefit in the United States, which can be activated for those with life expectancy of 6 months or less. It's typically administered not in concurrence or not along with curative treatments, as in the last few weeks and months of life, the intents are purely for comfort and quality of life. So the goal remains the same, whether it's hospice palliative care or it's palliative care early on in the disease, is for people to recognize that there is suffering and burden from the disease or multiple ailments, not only on them, but on their family, and it may be appropriate to ask for palliative care or ask for hospice. If they're in a hospital setting, then it's easiest because most of the hospitals in the United States now have palliative care teams, so it makes most sense and it's easiest, although it might be best to approach their primary care doctors or even specialist physicians who may be most closest to them and see them most often to ask whether palliative care might be appropriate for them.
It's really interesting because it isn't just I'm going to die and now I need hospice. There's that whole piece before with the palliative care to keep someone healthy.
Absolutely.
Like you said, wraparound
Absolutely.
services. So as a palliative care specialist, what do you feel is the most important way you can help the patient and the family?
So to be able to understand how palliative care helps and what it does, I think it's very important to understand how serious illness affects a person, the family, and their ecosystem at large. We now know that serious illness not only affects a person on a physical level, but mental, psychosocial, and spiritual level as well. As you move along with serious illness, we also find that you have more doctors to see, you have more medicines to take.
Right.
What happens with time is that in this whole big healthcare system, you keep becoming smaller and smaller, and somewhere there you feel very lonely with so many doctors, so many nurses, so many medicines and visits. And you lose control. Right. You lose control of your own life. What palliative care does is, with a team approach, it not only assists with the suffering of various natures, be it physical, psychosocial, spiritual, it also gives you back that control that makes you feel that you're not alone and you're still the driver. How it does is the important conversation, which I think is the key part of delivering palliative care, which involves getting to know you as a person, getting to know you as a family outside the disease, what your hopes are, what your fears are, how do you cope with these, what are your expectations for the future, and basically help you make good decisions and have a say in your own care.
I think all of it is like so important. So give me, if you could, some important questions for the patient and the family to answer as they begin this journey we call of self-discovery. So if you could give us that information.
Absolutely. As you yourself said, it is a journey. It is a process of discovering who you are and how this illness has affected you, and where do you want to go from here. And as much as it is a discovery for the patients and the families, it is a discovery for the healthcare professionals, because they want to know these things. They want to know how to help you out, and these are important questions. I have summarized these questions into 5 important issues. I think first of all, it's most important is touching bases, making sure we have all the information so we're able to make educated and informed decisions. Very often we see patients and families coming in with either requests that seem unrealistic but more often than not, it all comes down to lack of information or lack of understanding about what's going on and what's coming next. As healthcare professionals, we want to know where the family is, where the person is, so we can start from that level and give them information about what's been going on in the past, what's coming next, what are the options, and so forth. I think the next key thing here is to ask them about what's the best case scenarios they're hoping for as they live through a serious illness. I call this hopes. Sometimes I ask them, what are you hoping to achieve when it's all said and done? Well, for some, it's family, just more time with family. For some, it's religion. It's a key part of their lives and how they want to make decisions. For some, it's just independence, being able to take care of themselves. But everyone is unique, and it's very important for us to know what really matters to them. The next step, I think, is to know what's the worst case scenario in their minds and their hearts. What keeps them up? What are their fears? And all of us have seen the worst case scenarios on TV or in our families with our relatives or our friends going through serious illness. We've seen folks in a comatose state dependent on machines, and inherently we all have our fears that we may not end up into such a stage where it's basically not worth living. For some people, it's not being able to talk anymore or eat anymore or being able to walk by themselves. It's important to recognize what's really hiding inside themselves and bothering them as a worry. I think the next step is more of trade-offs, kind of balancing when it comes to quality of life and longevity or more time to your life. We've talked about the best case, what they're hoping for, and the worst case, which they wish they never end up. But it's not all cut and dry when it comes to so many medical interventions, so many treatments that we're offered. As we add on more medications and treatments, every treatment has its burden. And at some point in time, the burden reaches a threshold where you might say, it's enough.
Right.
I'm not ready to make those trade-offs for adding more time at the cost of quality. I want my quality back. And that's unique to you, and it's unique for every person. So it's very important for us to introspect and talk about that as we make choices for our future. Finally, I think it's key is how is your ecosystem, your family, your friends doing with this? Do they know about how sick you are? Do they know about your choices, your preferences, how you want to make decisions? Is there someone in the family who can understand the medical system well and speak up for you on your behalf if you're not able to speak up?
Right.
How much flexibility would you want to give them if they're making decisions for you? So that is very important to put down on paper as well and talk about with your family. So overall, once we sum this up, we call it the conversations, we call it the goals of care meetings, we call it care planning meetings. Bottom line is, I think it should be called what matters most to you meetings.
Right.
It essentially comes down to you, do you really understand what's going on with you, and what's really important to you at this stage, and how can we help you achieve that? I know you mentioned earlier in our conversations that your family went through something similar with your mom, I believe.
Yes.
Do you want to share with us more about
Absolutely. So being a nurse, it really helped me to know about this. And I was grateful that I did know about it. And my mother did, I'm an only child, so my mother had me as her proxy.
Okay.
And there was, in which she even wrote a living will. And at the end, she was intubated. She had some cardiac surgery, and she wasn't able to recover from that. So she had, tubes and more tubes, and that is clearly not what she wanted. So I made it very, very clear to everyone, as hard as that was, that that was not my mother's wishes. Sure. So I was so glad as a daughter that I didn't make that decision for her. She made that for herself. And then I was able to carry it out. So all of this conversation, what you're saying, is, in my opinion, utmost important. I mean, I don't know what I would have done had I not had that all in writing.
It's very important, that take home that you're talking about, that as a daughter, you felt so comfortable making those decisions because you knew that is what she would have said.
Right.
If she were to have magically woken up for a few seconds, she would have said, this is what I want.
Exactly.
And the other thing that is incredible in your story is that she was someone who was aging healthy and safely and independently in the community.
Totally.
She did not have many serious illnesses.
Nope.
And this was an unpredictable decline or an unpredictable serious illness which could happen to any of us at any age.
That's right.
And still, she was well prepared because she had had that conversation with her family and designated you her proxy.
That's right.
I think that's a very key message there.
I know. So you mentioned that we all have to have our say when we want. And I think it would be really good for the viewers to know, how can they have their say when it matters most?
Absolutely. Well, as you mentioned, you can absolutely have your say whether it's at any stage of your life. It's very important to have had thought about these issues that we just mentioned, have had the conversation with your family, with your friends, with your doctors, having had documented a healthcare proxy, and having documentation of what we call as a MOLST form. So we'll go into these documents. As far as Massachusetts is concerned, there are two key forms. There's the Massachusetts Healthcare Proxy Form, which essentially anyone above 18 years of age can designate a proxy. A proxy is essentially an individual who's capable of making decisions for you at a stage when you're not able to speak for yourself. What MOLST form does is a step forwards. MOLST form is the Massachusetts Medical Orders for Life-Sustaining Treatment. Our viewers probably have heard of terms like DNR, DNI, do not resuscitate, or a full code, and so forth. Well, these are all technical terms which we as health providers use to communicate within ourselves the goals that we just talked about.
Right.
So unless we have these in writing, they're not going to be followed, and unfortunately, you're not going to have your say. So luckily in Massachusetts, we have this MOLST form. And in various states, there are similar parallel forms, which are orders from your physician who's had that conversation with you and your family, which paramedics, emergency rooms, and all healthcare settings have to follow. So that's very powerful.
Dr. Bharija, before we say goodbye to you, I'd really like to ask you about just a general summary of what we said today, maybe just one big take-home message for our viewing audience.
Sure. I think, Amy, it's when it comes to dealing with serious illness, something that I have learned myself and taking care of so many patients and their families, is that it's very easy to feel lonely, feel that you don't have any control, that you're a small object in this whole mega healthcare system,
Right.
which doesn't seem like it's working around you, but it's just working on its own pace. But I think it's very important to speak up and know that there are ears to listen. There are ways in which you can get help. One of which we just said was to ask for a palliative care service, whether you're in a hospital or outside. And also to start the conversation about what's really important to you, what really matters to you at this stage. Do you really understand what's going on with your life and your health and what's coming next? And if those questions bring doubts and you're not able to come up with answers, that means you need to talk about it with your doctors and bring it up with your primary care doctors or specialty, your heart, your kidney, your lung doctors who have been seeing you again and again about your heart and lung and kidneys. But I'm sure if you bring it up, they're going to care about what you want as a person as well. So I think it comes down to not feeling lonely and asking for help and asking for palliative care and making sure that you know your options and have your say.
Good. Thank you. That was a good answer. I like that. I think all of this information today was beyond exceptionally needed for our viewing audience. We are blessed to have you as part of our program, as part of our care team, and I just know people will reach out and see this session today and learn an awful lot. So thank you for coming.
It's a privilege and an honor. Yeah.
Thank you very much.
I love taking care of my mom. It wasn't easy at first. She learned how to better communicate her needs.
And you learned how to not ignore yours.
I discovered how to make healthier meals.
And I discovered how much I enjoyed them.
Becoming a caregiver is a learning experience for everyone. Find articles, tips, and tools from experts and others who have been in your place. The Caregiving Resource Center at aarp.org/caregiving.
I want to thank you again for tuning in to Checking In with Amy. I want you to know that we have resources at the end of this program, and there's a list of them that I think would be very valuable. We would love to send them out to you in our Checking In with Amy bag, and that can be from this show or any other previous shows that we have had. Please know that you can get in touch with us at area code 617-568-6377. You can also email me at checkingin@ebnhc.org. And until we meet again, thank you for tuning in. Bye now.
My parents were always very independent. They always seemed to take care of each other. My dad met my mom when she was 13 and he was 15, so they got a lot of practice. It was really difficult when they were faced with health challenges and started to need some help. It was also really hard on me and my brothers. It seemed like every day we were getting calls. They needed to go to this appointment or that appointment, and it became pretty apparent that they really couldn't live on their own without some help, and more importantly, stay healthy. We're lucky to find the Elder Service Plan, Almost immediately after enrolling, we saw some real change for the positive. All their medical appointments were in the same location, including the prescriptions. If they did need to go to see a specialist, then transportation would take them, and that was a big relief for us. My mom attended the PACE Day Center each day where she could really socialize, and she loved that. When they needed services in the home, that was a big help too. And my dad, he'd still call me every day, but not because he had to, because he wanted to. He'd say, "Stevie, you won't believe it, they fixed my teeth. They got me some new shoes today." Just brought some amazing stability to the family. I'll see you a little later today, okay?
Okay.
My name's Lucas Akerley. I'm the activities coordinator for the Elder Service Plan in Winthrop. Today we're doing active parachute games. We have a ball toss with some music. It's fun. Keeping active at ESP is part of our plan to keep you happy, healthy, and independent.
Our mission at the Elder Service Plan is to keep our participants living safely in the community. And we do that in a number of ways, the first being with the physician and the entire team to take care of the person medically. We also try to think creatively and provide other things that they may need, be it shopping service, laundry service. We may provide respite for the caregiver, or even aid visits in our supported housing. We try to be as flexible as possible here in the Elder Service Plan to reach the goal of keeping our participants living safely in the community.
My name is Patty Ferranti, and I'm with the Elder Service Care Program, and I absolutely love it. Just talking about it right now makes me want to cry. Before I was in the ESP, I was always calling my family and having them, pick me up to take me to doctor's appointments and stuff like that. And now now that I'm in ESP, I have the door-to-door service, coordinated care. My doctor always knows I'm coming. They always arrange my appointments. Everything is just so perfect. The program is fantastic, it really is.
Any pain when you do that? As a physical therapist in the Elder Service Plan, a big part of my job is to help people keep up with their strength and balance. A lot of times I see people after they get injured or some type of surgery, but another part of my job is to make sure people stay active with the regular exercise program so they don't lose the strength and balance they gain back.
What we do is we talk to the person to find out what they want. Do they want to increase their endurance, their strength? Do they want to be able to do things easier throughout the course of their day? We will work with them and develop a plan, and we move forward with it.
We try really hard to keep up with the mission of the program, which is to keep people in the community of their choosing for as long as possible and as safe as possible. Even sometimes just a cane or a walker can make all the difference in making sure people stay safe.
Very central to our plan and what we do here is the patient, the person. And the way we deliver that care is by having a care plan which centers around the person's goals, their choices.
As the medical director for the Elder Service Plan for the last 25 years, I've had the pleasure of watching our program grow enormously. While we started out largely in East Boston, we now serve participants in Chelsea, Revere, Everett, East Boston, and Winthrop. I think one of the real great reasons for our success is our ability to comprehensively coordinate our participants' needs. It's not just seeing the doctor or the nurse. Pharmacists, activities directors, nurses, nurse practitioners, van drivers, dietitians, all of us work together under one roof to keep our members healthy, active, and independent.